live now.
Great, good morning. This is Senate Government Operations Committee on Friday, May 12th, what we hope is the last day of the session. And we are taking a look at the House amendment to S39. We have Jen Carvey with us to walk us through the changes. Thank you.
Great. Good morning, Jen Carvey, Legislative Counsel. Yes, so the bill passed on third reading in the Senate and the House yesterday. It's somewhere between there and the Senate. But in the meantime, I've done a markup version I used your version that you voted out of the Senate and then showed House markup in yellow highlight. So, so the first change is not, you can't see it. So that's why it's got the little red parenthetical there. And some of you have heard about this already, but the House did push off the effective date for the health insurance until next year and added a provision for the study committee to look at it. There was concern raised about the impact on people who are currently eligible for subsidies for coverage through Vermont Health Connect, that for whom it may be considerably more expensive to have the state employee plan instead of being eligible for subsidies. And under federal law, you would not be eligible, at least for federal subsidies, if you have an offer of employer-sponsored insurance, unless that insurance is unaffordable under federal standards, which means more than 9.12% of household income. There was significant concern raised, or I think enough concern raised, and some scenarios provided by the Office of the Healthcare Advocate that showed, depending on family composition and income, there might be some people for whom one or the other would be a better option. So the House chose to delay it for a year to understand more about what the impact might be.
Sorry, go ahead.
I'm just wondering, and this is sort of the legal landscape. So open enrollment for the exchanges in December, right?
It is typically from mid-November through the end of December or thereabouts.
And this wouldn't technically be an offer of insurance until January 1st of 2024. So is there a window there in which someone could legitimately say, no, I don't have employee-sponsored health insurance, because this wouldn't have actually gone into effect?
I think it matters for each month. So, so there may not be federal set. I don't think it's a point in time at the time of enrollment. It matters whether you have the offer accessible.
Okay.
Interesting though.
Okay, carry on.
I know. I wish we could hear from Mike though, because I'm
He's right
still
there.
Not that Mike.
So there are.
Fisher.
Yeah, because I just don't know enough about like the subsidies and those rates and the state employees plan. It's such a low rate of pay, or the contribution is really not high.
I think it depends. So there is, you can find on the House GovOps website, Mike Fisher had brought just a few scenarios where his team modeled out some scenarios. Fisher, if I said Mike wrong. Mike Fisher modeled out some scenarios.
They're all essential, those mics.
About what it might look like depending on whether it was a single person or a couple or a family, how much their income was. But there, you'll see if you look at it that there are some cases where somebody might currently pay nothing.
Okay.
Or they might pay $29 for $29.38 for this is for a single person making $30,000 a year. The only plan for which they would be better off on the state employee plan is at the platinum level, which is, the state employee plan is a very rich plan. And when we say rich, we're typically talking about actuarial value, which is the average amount that the patient, the consumer, pays out of pocket for services. So outside of the premium, what do they actually end up paying out of pocket versus what the insurer pays, the plan pays for the services. So under the state employees plan, there's not a whole lot of out of pocket. And certainly for some people who use healthcare, that's a really important plan feature. And so they may be looking at a platinum plan on the exchange that would have a similar actuarial value. But for somebody who is healthy and doesn't use a lot of services, they may have opted to do a plan with a higher deductible that is a much lower premium And so I think it was really a matter of not, I don't love the term winners and losers, that's what they were using, but it was a matter of not knowing who would be the winners and losers in the scenario, and concern about putting everybody into one bucket without understanding what the implications might be.
Okay. Do you have a question, Sarah?
No, it's an unfortunate but good catch.
Yes. Both of those are good. All right. And just from a practical standpoint, you won't be able to see it. We'll see it when we get to the end and the effective dates. But because the default effective date for the whole bill for everything that wasn't mentioned was January 1st, 2025, I just took out the effective date for the health benefits.
Whatever.
So it's harder to see, but I want you to notice there. All right, the next changes do not occur, so they did not change anything on the numbers, the compensation numbers that you did. They made, so the next change is on page 8, but it's in section 4, so just to orient you, that is the section on compensation and expense reimbursement for members of the General Assembly. The first change that they made on the top of page 8 was to make the adjournment compensation something that people have to claim rather than an automatic payment. So there was some concern expressed, I think, about just assuming that everyone was working during adjournment in a manner that would make it appropriate to pay them, and so wanted there to be an affirmative requirement to claim the compensation during adjournment.
And when does that begin?
That adjournment compensation begins on January 1st of 2025.
Okay.
So they didn't change that. The next changes look bigger than they are. I think on pages 8 and 9, this is dealing with the meals and lodging allowance. And so the first thing that this did was to create a default presumption that members are going with the allowance unless they affirmatively inform the Office of Legislative Operations, Mike Braun's office, before the session that they want to do reimbursement, and then that reimbursement choice would stay in effect through the rest of the session unless, and then that happens that you talked about, that the member notifies the office in writing that they need to change, in this case, to the meals allowance due to a change in circumstances or another compelling reason. So the big change in this piece is making a default so that Mike Braun does not have to track down every member to get their choice. It sets a default presumption, and that presumption can be overcome by a member who wants to do something different. And then there is a correction to what I believe was your intent, but not perfectly captured in the language as it came out of the Senate, which deals with the reimbursement provisions and setting the cap. And so there have been some concern, I think it came up particularly in Senate Appropriations, about, well, this is suddenly introducing this idea of the night before the session for meals and lodging, and so couldn't somebody end up getting more with reimbursement? And the way I phrased the cap wasn't entirely clear. So now this would say that the cap is shall not exceed the amount that the member would have gotten for the same week if they had gone with the allowance.
Yeah.
So that way, if it ends up being a five-day session week, like this week was, then it would be whatever you would have gotten under the allowance for that week. And if it's a 4-day and somebody wants to stay 5 nights, they still can't get more than they would have gotten if they had done
Oh, really? But what if you do come down early, or you're a senator and you come in on a Monday?
So if you come in, right now your allowance is only for the days that you actually, that the legislature meets. So typically 4 days worth. So if a member comes down on Monday and stays over Monday night, Tuesday night, Wednesday night, Thursday night, and goes home on Friday after the session, you're in no worse shape. If the member stays over Friday because it goes very late, then you're capped at whatever you would have gotten for the full amount of the allowance for the week. So if a member chooses to stay an extra night, you may or may not bump up against that cap, but generally the nights work kind of the same as calculating based on the days.
Okay.
All right.
I know a lot of us rent apartments, so like the thing is we're always paying for those apartments, whether we stay here or
Right,
not.
and I think Mike's gonna have to work out with you all how we're gonna calculate that.
Yeah,
Um,
because definitely our rent far exceeds the nightly amount.
Right, and I think we will need to figure out a way to reflect the realities of what it means to rent an apartment, or something like that, and how to structure that. I think, Mike, is that what you're thinking? Recognizing that you are paying for nights that you are not here because that's the nature of a lease. And I don't believe that the idea was to penalize people for doing that with reimbursement, but rather how do we kind of structure the calculation so that you get reimbursed appropriately.
Okay, thank you. You've thought about it all?
We're trying to.
Good team.
All right, and then the change at the top of page 12 is really just a conforming change reflecting that for an absence, you would not receive or be reimbursed for the expenses. All right, and then we get into the working group. So here are the next main changes. So for the working group, the Legislative Service Working Group in section 6, they're directed, as you know, to look at a number of things involving compensation and benefits. So the first change here is that one we talked about earlier about the impact of making members eligible for the state employees health plan, as set forth in section 1, on members of different income levels. So making sure that there's that focus on that health insurance piece. Also added, the other two were added on the House floor. Options for establishing or engaging an independent entity to make adjustments to legislative compensation and benefits. That was one of the things you heard from NCSL, that in some states they have an independent entity that just sets legislative compensation. And then a new one at the bottom of the list. So as you'll see, the re-lettered subdivision H that was in the bill you passed out is how the salaries, benefits, and compensation structure in the Vermont General Assembly compared to those of other state legislatures. This would also have them look at and how they compare to the mean and median compensation and benefits of Vermont residents. All right, then the next change is on page 16. This deals with the report, and this was language that we didn't talk much about, I think, when it was in here, but that I had asked to be included, I think, when the bill was originally created, looking at the idea of trying to create some boundaries around staff while we're doing our work, and the increasing number of records or requests that are public records requests for documents that are in progress. This has come up a number of times in the last year or so in difficult ways. And so there was some alarm with the way the language was worded, which is not my intent, which had said drafts of the working group's report shall be confidential unless publicly released. My understanding on that one, and this is based on some language I talked about with some colleagues, was just, when we're working on it, it's confidential, and then when it goes to everybody, when it's publicly released. There was some concern that this suggested that the work was going to be somehow done in secret with the committee seeing drafts, but there being some decision point at which public release would happen. That was not what I was envisioning, and so there was a request made that makes sense to me to change this to say drafts of the working group's report that are in progress but have not yet been shared with the working group shall be confidential.
Okay.
So please let me finish typing the report before, and then send it to the committee at the same time I send it to anybody else. So we may come back to you to talk about having language like this more broadly next year. I think it could be very helpful.
I do have to go to a conference committee here.
Okay.
So
Are you,
I have one question.
yeah, go ahead.
Is this a study or is this not a study? What is it? What's the working group's focus here?
Yes, the working group is
To study what, Jen?
to study issues about legislator compensation, benefits, staffing, administrative support, the length of the session.
Okay, so they're gonna bring a report back to
They're
us
gonna
from
bring a
the
report
study
back in
before we
January.
finalize anything?
No, the rest of
Well-
it goes into, as it came out of the Senate and as it came out back to you from the House, a number of the provisions take effect in 25, 26, and 27, but there's also some additional study to see if more changes should be made.
Okay, we're doing a straw vote as long as we're As long as the study's coming back, I'll vote in favor. I'll
Okay.
concur.
Nice jacket.
Okay, thank you very much.
Very
All right,
good.
thanks, have fun at your conference
All
committee.
right.
Oh, yeah, remind Randy has to sign those cards.
I'm not going to Randy's.
Oh, okay, you're going somewhere else. Okay. I'm
All
excited.
right, let's finish this
All
up.
right. All right, so I may come back to you next year and talk more about this idea of trying to allow your staff to do our work before turning things over to people who are not our clients.
Yeah.
All right, and then on page 17, the change on line 7 is something you thought you did, or the Senate thought, the Appropriations Committee thought that they did, but for whatever reason, it did not make it into the version that the Senate Secretary's Office pulled into the calendar and journal, and that is to have 6 meetings instead of 8 meetings, or per diems for 6 meetings instead of 8 meetings. That was something Appropriations had requested and a change I'd made, but I think we just had a timing hiccup with when they pulled the document. So
Sorry, what page you on, Jen?
page 17,
Oh, we're getting near the end.
we are. So this is making the change the Senate, at least Appropriations had intended. In the middle of the page, this strikes out the appropriation. The appropriation, as you remember, was for half a year of health insurance. And since we're delaying that for a year, there is no FY24 appropriation. Then finally, in the effective dates, we just have conforming changes there. So the appropriation section came out, it's not highlighted, but the health benefits piece came out, which means it falls to the default, which is the very last line on page 18 of the remaining sections take effect January 1st, 2025.
Great. Are there any questions for Jen?
Many,
Are
but
there
maybe
any
not.
questions for Mike, who's in the room also?
Oh.
Okay. Is the committee comfortable with concurring? 'Cause yeah,
At this
then
point,
we're-
I
yes.
don't like it, but I'll concur.
Okay.
It moves it forward.
That's exactly why I'll concur.
Yeah,
I mean, I think it's there, that Mike has a valid, point, kind of, in that people will pay more in premiums, but they may not actually in their total out-of-pocket cost be paying more because they're getting a much better plan. And I know there's members of the General Assembly right now that just don't have health insurance, and we're asking them to wait another year. So I have significant concerns pushing that out, and it will move it forward. So I will very reluctantly vote to concur.
So may I just tag on to that, Madam Chair?
Yes.
We never did the survey. I think we might, as a committee, really want to know more in terms of, and this may be something that the service committee, the
Right.
summer study
Yeah.
committee does, but I would urge them to do a survey. We have no idea what the health benefit status is of our members. I mean, we just don't know so much. So what the uptake would be, what people's family configurations are like. I mean, and it's not like that'll be that same thing forever, but it'll be a good indicator for the next couple of years. We really need to do a survey of our members.
Yeah, I mean, I think that's something the committee can do. That's.
Yeah.
I think we had talked about that.
Yeah.
Yeah.
All right.
Yeah,
Well,
that's my concern. I'm just looking at like premium cost only, is not actually looking at the full cost of healthcare.
yeah.
And just may I say one more thing?
Sure.
I'm so thrilled we're doing this. I have had bills in for so long on out of session pay, on this or that, on tweaking around the edges. It is so great to be doing a comprehensive review of compensation for people who give so much in public service and who expect so little and get so little in return. So I mean, we get lots of other things, but we have to make it manageable financially. So this is such a great step forward. Thank you, Anya, for your leadership on this and for all of our work on this. It's just great. Very excited.
Future of the legislature.
And with a
All right.
29-year-old district mate, this is
So-
really important.
I saw everybody with thumbs up, so we're gonna say thank you, Jen,
Sure.
very much. Do you want to stand up, or would you like me to?
I'm happy to do it.
Okay, and just walk through the changes and say.
Sure.
And are we doing this charter later?
Yeah, let me just.
Yeah, so for the charter, everybody, thanks, Jen, we're done with that. So just so you guys know, for the charter, the situation that we're in is that we,
If I need you, I'll write it. Okay. I think I got it. Thank you very much.
thanks, guys. We don't have possession of the bill, because it went, but with Senate rules, it goes to the Rules Committee. So the Rules Committee has possession of it. So we have to have at the beginning of when we're on the floor, suspension of the rules to get it out of rules, to send it to us. And then we're gonna have a little meeting we're gonna take a recess and have a little meeting of our committee to vote on it up on the floor.
Like
So-
at 10?
I think so. I'll double check with that, but,
Yeah, just shortly thereafter, we're gonna have what we call a huddle.
we're gonna have a huddle vote, given the fact that it's a non-controversial,
Yeah.
charter change, it should be fine.
Okay.
And, then it will be on the floor and you can do your floor report and we'll take it through all stages and
This is
do all
the
that.
water bridge expiry.
Yeah, the one with the stranded assets.
EFUD.
So,
Yes.
Yes. all right, so that's the plan. So just